I'm Dr. Amy Chapman Jackson, and I'm a board-certified plastic surgeon, and I work for Western Maryland Health System. Finding out that you have breast cancer can be a very stressful thing. I have found that meeting with patients early in their care and discussing their options for reconstruction and all the different types available can be very useful. It can be useful for them to understand what is available, and then also to help give them hope that they'll feel whole at the end when they've completed their treatments and they're getting on with their normal life. I'm here today to talk about breast reconstruction, and the type of breast reconstruction that I'm going to discuss is a two-stage breast reconstruction. That's probably the most prevalent breast reconstruction done. What it entails is placing a tissue expander followed by placement of an implant. So how it comes to be, first the patient undergoes a mastectomy, and they either have a nipple-sparing mastectomy or a skin-sparing mastectomy based on their cancer and what they're a candidate for. Once the mastectomy portion of the procedure is complete, I will enter the operating room, and at that time I use what tissue's left to reconstruct a breast mound. What made this procedure so prevalent is a substance called alloderm, which is an acellular dermal matrix. And what that is it's skin, or the dermis, of a cadaver that's been donated for use in medical reconstructions. So how this is done is a piece of this is sutured to the chest wall, and a pocket is created, or a sling, and underneath that sling a tissue expander is placed. The tissue expander is empty of fluid, and as you can see there's a metal disc here with a self-sealing port. So how that is placed under the alloderm and then underneath the skin flaps that were left from the mastectomy, drains are placed. Two are placed, one below in the inframammary fold of the breast and one up top, and that goes out into the armpit or the axilla. Once the tissue expander is in place, it's then accessed with a needle, and either air or fluid is placed into the tissue expander to take up the free space that is left behind from the skin. No tension is placed along the incision line, so the patient still has a deflated appearance to the breast on this side, but less deflated than if no tissue expander was placed. The patient is then admitted to the hospital. She's cared for, pain's controlled, and when she's ready to go home, she's discharged. I then see them a couple days later to check the skin flaps, to check the tissue expander, to check the fluid that's coming out in the drains. And then over the period of 2 to 3 weeks, the drains will come out when the fluid output's down. After the incision line has completely healed, she'll come weekly, every 2 weeks, to have the port accessed and the tissue expander expanded until we get to the size that matches her contralateral side, or the size that she wishes to be. After her other treatments are complete, such as chemotherapy and radiation, and the timing depends on how well the woman is ready to undergo another surgery, but once she is deemed ready to go through surgery again, we go back to the operating room. This tissue expander is removed. The alloderm has incorporated into her own skin to make it thicker, and it's made a new capsule or pocket for the next item. And then we place a implant, which this is a silicone implant, into that pocket. A lot of times at that stage I also do what's called fat grafting, and what that is I take fat from the woman's abdominal area and I inject it around the tissue that surrounds the implant to help obscure the edges of the implant, to help obscure rippling, and also just when the implant starts and stops. So that's the two-stage of breast recon. This is an idea of kind of how the port is accessed in the office. It's a little magnet that shows me where to put the needles, so it's usually just one stick when they come in, and a lot of times due to the mastectomy they don't have any feeling at that point, so it's usually a painless procedure. Once your implant surgery is complete and you're healed, there's other modalities to help make the breast appear more natural. For the women that did not have nipple-sparing mastectomies, a nipple areolar complex can be tattooed into place as a 3D tattoo, or you can have a nipple recreated for the projection followed by a tattoo to give a more real-like appearance. For more information, please see our Facebook page, website, or call for a consultation.